Good afternoon, everyone. Today we will be discussing about the changes that have been made to the postgraduate medical education in the postgraduate medical education regulations 2023. These are new regulations that have come after a gap of 23 years. The last ones were in 2000, the last time the regulations were updated. So this is a very welcomed change as a lot of these changes have been very clearly defined in this. We will go step by step and try to cover most of the changes in headings. First, we will be talking about the recognition of mental health of postgraduate students. So the Act says that it is heartening to note that the ongoing debate over mental health of postgraduate students has been recognized by the NMC, and the same has been reflected in the form of acceptance of reasonable working hours in a day for postgraduate student. Though nowhere is it mentioned that how many hours a postgraduate resident is supposed to work, but then they have said that whatever the institute decides should be under the reasonable limits. Then comes the poster presentation slash paper presentation slash research presentation. These are basically the requirements that are necessary for a postgraduate student to be eligible for his final MD examination. In the recently released PGMER 23, these requirements have been marked as below. Now, initially, a PG resident had to do all three of them, but now, as per the new PGME regulations 23, we are supposed to do only one of these three. We are either supposed to do a poster presentation at a national, zonal, or state conference of his or her specialty, podium presentation at a national, zonal, state conference of his or her specialty, and have one research paper published accepted for publication in the journal of his or her specialty as the first author. Now they have made it mandatory that whatever publication that you are going to make, these publications should only be made in the journal of your respective specialty. A psychiatrist will have to publish whatever piece of article, poster, or anything that he is publishing in a journal which is a psychiatric journal. The pros of this, so this thing has both pros and cons of it. The pros of it that are there that is that it will be advantageous for PG students, as they will now need to undertake any one of the three activities: either present a poster or a paper at a conference or publish a paper in a journal, and not all three activities. Moreover, now PG student will be designated as the first author in the paper originating from their own research work, and will not be at the mercy of their supervisor for the same. This change has mainly been made because initially the PG student had to do all the three activities, but it had been found that to complete these activities, most of the three things would be done in the final 6 months of the postgraduate training. So it used to become cumbersome. Now the cons of it is that however PG students have to present a paper or a poster now in the conference of their own specialty, what we have already discussed. Furthermore, the research paper needs to be at least accepted for publication in the journal of their own specialty. This will be a bit tricky because finding a specialty journal for so many PG students across India from one specialty might be difficult, because there are limited number, like if we take for example psychiatry, there are limited number of journals of psychiatry in India, and there are limited number of opportunities for the publications to be done. That's why if you consider the entire pan India situation, it might be difficult for a PG student to find a psychiatry journal and be able to publish in it. But the regulations have made it mandatory for the PG student to do so. However, at the same time, this condition is not mandatory now, and this will now also enforce students and supervisors to undertake good thesis research to get the paper accepted in their specialty journal. Now, what new courses slash changes in existing courses have been done is that in addition to the ongoing online course on research methodology and DRP, now PG students are required to complete a course in good ethics. DRP and online course on research methodology is already mandatory for the PG students. Along with that, a course in ethics is also added, which includes good clinical practices and good laboratory practices, whichever is relevant for the course that the PG student is doing. Along with that, a course in BCLS and ACLS skills is also required. These new courses will be conducted by the institution and students need to complete them during their first year of training. Moreover, it will now be mandatory for all medical institutes to submit their DRP posting details of the students to PGMBB of the NMC within 1 week of completion of the DRP. Now, leave rules and attendance criteria, something that has been critically analyzed by most of the PG students. Now PG students will be entitled to 20 paid casual leaves per year and 5 additional paid academic leaves per year, along with maternity/paternity leaves as per the existing governmental rules. Now if we along with a weekly holiday off, if we calculate the total number of leaves, it comes down to around 77 leaves slash holidays in a year, considering that one weekly holiday along with the leave is taken together. There is also an 80% attendance criteria for to be eligible for the final exams. Cumulative attendance in the full course will be considered and not the attendance in every 6-month term. Initially, how it used to be how it used to happen is that a course would be divided in 6 months time, and 80% attendance in every 6 months duration, that every semester duration was mandatory. Now a PG student will need an 80% attendance throughout the 3-year course. So it's not semester wise anymore. So if it can also be interpreted that that holidays or leaves taken during a certain semester wherein you might be falling short of 80% can be then covered onto in the semesters to come. Hence, if a student avails more leaves in one term, it can be compensated by 100% attendance in the next term. And again, such a clause is beneficial for the students. Now we come down to examination evaluation rules. I think after the leaves, this is the second most important part that every PG student might have critically analyzed. Now there can be a minimum gap of 8 months between two postgraduate final university exams compared to 6 months as per the 2000 regulations. The minimum gap of 4 months between two examination remains the same. Although the number of examiners for the examination is the same as earlier, that is 2 internals and 2 externals. Now only one external examiner is required to be out of state. So you can have one external examiner from your state and one examiner from out of state. The criteria for appointment of postgraduate examiners have also been changed. Now to be appointed as an examiner, both for the internal examiner and the external examiner, a faculty must possess 3 years of experience as a recognized postgraduate guide in the concerned subject. Initially it was that postgraduate teaching experience was also considered. Now they have moved on to 3 years of experience as a recognized postgraduate guide in the concerned subject. These are two changes. One, for external examination, the criteria have been changed from 6 years to 3 years. Second, for both examiners, that means external and internal examiners, the criteria has been changed from PG teacher to PG guide. This means that even if one is recognized for PG teaching for 3 years, as the PG course in the concerned department has been conducted for the last 3 to 4 years, but she is not having PG guide experience of 3 years in the department unit, so no PG student has been allotted. She cannot be appointed as a PG examiner. So the criteria has been changed from PG teacher or to PG guide. Now we'll come down to examinations and examination rule. As per the PGMER 23, the theory examinations, both formative and summative, may be of descriptive answer of a question type, multiple choice question type, or mix of both types. Now throughout the document, I couldn't find the exact time in which they are planning to implement this. So it might be as soon as the current exam going batch, or it might be that it might get implemented for the 2023 batch. This literally means that full theory papers can be of MCQ type. This is in stark contrast to PGMER 2000, by which MCQ was not allowed in postgraduate examination. Furthermore, the first and fourth paper have been fixed on basic medical sciences and recent advances respectively. Now, whatever online forums or other forums are discussing is that there will be a combination of MCQ and written examination. It cannot be that there will be an entire MCQ paper, but the consensus says that it might be an 80-20 distribution, though exact format of the paper is still not out. Exam checking, although all the answer scripts should be evaluated by 2 examiners, and the average of the total marks awarded by the 2 evaluators of the paper rounded off to the nearest whole number shall be considered for computation of the result. Now what they are trying to say is that 2 examiners will check the papers and the average of both will be considered. But there is a clause in this that if the 2 examiners have separately checked the papers and there is more than 15% discrepancy in the marks that have been awarded by both the examiners, there will be a third evaluation done by a separate evaluator who will also check the paper. The average of best 2 total marks. That means that it can be that A has given 80 and B has given 60. So there is more than 15% difference. So a third evaluator C was called and C gives marks as 70. So the top 2 marks, which are 80 and 70, will be taken together to make an average of 75. Nearest integer shall be considered for the final computation of the result. No re-evaluation is permitted once the result has been declared. All the universities imparting postgraduate courses have been asked to implement digital valuation. For the first time, 20 marks to be added in the clinical/practical examination. Again, where exactly will it be added is not given, but most probably this will be in the practical examination as it pertains the thesis. Have been assigned to the thesis an external examiner from outside the state. So as we have 2 examiners, one will be state and one will be from the outside part. So the outside external examiner will evaluate the thesis, conduct thesis viva and allocate marks based on the quality of the thesis and performance of the student on the viva. So 20 marks have been reserved probably, most probably in the practical examination for the external out of state examiner to do the thesis evaluation and viva on it. Now requirements for appearing in the final university examination. Considering the PGMER 23, a student will need to fulfill the following requirements to be eligible for the final university examination. Minimum 80% attendance. Now again there is some discrepancy in the calculation of 80% attendance, because if we count the number of holidays and we try to calculate 80% from 3 years, so if a student takes complete holidays, then his attendance will be below 80%. But if you deduct the number of holidays from a total duration of 3 years and then try to take 80%, then it makes more sense. Certification in the online course on research methodology is mandatory. Certification in course of ethics, including good clinical practice and good laboratory practice, whichever is relevant for the course, is mandatory. Certificate in courses on BCLS and ACLS skills is mandatory. Certification of satisfactory completion of the DRP district residency program is mandatory, and thesis submitted to the university for evaluation is mandatory. Now this is what you need at the time when you're giving the exam. What do you need to have 6 months before the examination? So thesis acceptance as per the norms should be done 6 months before the examination, and any one of the research publication activities, either of the 3, have to be done 6 months in advance to your final examination. Poster presentation or podium presentation in a concerned specialty conference or paper publication / acceptance in a concerned specialty journal as the first author. Any other course / requirement as mandated by the institute. So they have kept a separate clause as if the institute has certain requirements of their own. So all of these requirements need to be done 6 months before your final examination. A few areas requiring clarification / addition in the PGMER regulations 23. So they are saying that PGMER applicable from the date of gazetted notification, that is 29th December 2023. However, many criteria, example certification in the course on ethics or certification of BCLS and ACLS skill cannot be applied for current batches. Though they might say that the BCLS and ACLS certification can be done later in your course. The PGMER document says that you have to do it in first year, but if they were to hard and fast apply it, they might say that you just get the BCLS and ACLS certification done in your second or third year, wherever you are right now. A footnote should have been added for all such rules, indicating that these will be applicable from admission batch 2023 only. We have a special note at the end also. What will happen in case of unsatisfactory completion of DRP, consequences and action thereof could have been explained in no uncertain terms. So if someone doesn't complete DRP or does not get completion of DRP, then what will happen with that student is something ambiguous. Due consideration could have been given to internal assessment by making it a qualifying criteria for the final university examination. Nowhere in the dossier does a mention of internal examination come into play. Say a minimum of 50% internal assessment mandatory to appear in the final university examination. Now during our MBBS days, this was something that was necessary to appear in the final examination. But here there is no mention of internal assessment. As per teachers' eligibility criteria qualification in vogue in the Department of Anatomy, Physiology and Biochemistry, non-medical graduates having MSc and PhD qualification granted by recognized medical college or institute as a regular on-campus course in the subject concerned can be appointed as assistant professors. Moreover, for holders of MD, PhD in medical subjects, the period spent during a PhD is now considered equivalent to senior residency period, making them eligible for direct appointment as assistant professors in the concerned subject. Under these circumstances, if it would have been better if MSc and PhD courses in medical colleges have been brought under the purview of NMC, as has been done for PDCC and PDF courses. To summarize, without a doubt, the PGMER is now a consolidated document reflecting transparency and leaving nothing to ambiguity, though there are certain areas wherein there is still some bit of ambiguity present. Its implementation will definitely improve the standard of postgraduate training with the mandatory introduction of courses in ethics, BCLS, ACLS, and with continued implementation of online courses in research methodology and DRP. It will also relieve the PG students of the burden of undertaking different research publication activities in the form of presenting posters and papers and publishing a research paper. Now they can choose any one of the following. And fixation on the number of leaves and provision of weekly holidays will definitely provide a step ahead in taking care of PG residents' mental and physical exhaustion. From the faculty point of view, the experience needed to be appointed as an external examination has been reduced to 3 years. From the administration point of view, only one external examination need to be arranged from out of state. The introduction of e-logbook and digital valuation of answer sheets are the steps echoing with aspirations of the Government of India, Digital India. This document literally has something for everyone. In a nutshell, this document is going to be a tension-free and more productive working environment in medical institutes for PG medical training. Now, special note which was given in the review article, during an interactive meet of NMC officials with the principal and senior faculty members of Medical Institutes of North India at AIIMS New Delhi on February 4, 2024. NMC has clarified that institutions must train all the postgraduate batches of 2021 and 2022 also in required courses. One of the authors personally attended that interactive meet. Now here they use the word also. So we do not know if they also refer to the 2020 batch, which has passed. So it's 2021 and 2022. Thank you.